Ladies and gentlemen, good morning. I hope everybody is doing fine and God is with you all. Today, we are going to continue with our topic of yesterday, whereby we were discussing about urinary tract infections, which in other terms it can be called sexually transmitted infections. And before we continue, for those who have not subscribed, please consider subscribing, sharing, liking and commenting. Back to our topic. In most cases, you find that antibiotics are usually used to treat urinary tract infections, and the length or the duration on how many days or for how long a patient is going to use antibiotics usually depends on the degree or level of infection, because all patients can't have the same level of infection. Antibiotics and penicillins are mostly used in these cases. Well, in a case of a simple infection, we can use antibiotics like cephalexin. We can use nitrofurantoin in cases of pregnant women. We can also use doxycycline. We can also use ceftriaxone. And in this case, I can give the specific dose to use, because this depends on the infection, and the healthcare provider will determine the dosage in which a patient is going to use at that particular moment. In complicated cases of urinary tract infections, for example, whereby we have a kidney disease, we can try to use strong antibiotics like ciprofloxacin or levofloxacin. Note, urinary tract infection symptoms clear up within a few days of commencement of treatment, but even if the symptoms clear, you have to continue with the treatment for at least a week or more. In cases of pain, the healthcare provider may decide to give you an analgesic or a painkiller to accompany the antibiotics. Note also, frequent UTI infection patients can 1. Use low dose antibiotics for 6 months or longer. Number 2, they should stay in touch with healthcare providers, that is, those who are prone to urinary tract infections. Number 3, they can take single dose of antibiotics after sexual intercourse. Note this, they can take a single dose of antibiotics after sexual intercourse, that is, if the urinary tract infections are related to sexual activity. I hope you get that point. Number 4, vaginal estrogen therapy can be done, especially for those women who have reached the age of menopause, or let's say 45 years and above. That is the end of our first video for today. Please guys, consider subscribing, continue supporting our channel, and I do appreciate a lot for the support and the far you have taken me. Let's meet in the next video, whereby we are going to discuss other conditions related to urinary tract infections, all other conditions that can be mistaken as S.T.I'S or U.T.I's. Thank you.